Injuries, accidents, and disease can all have an impact on the brain. In order to learn how to help people in those situations, doctors are trying to learn more about how the brain does what it does. In our cover story, Rod Starnes has details on how experts at Baptist are making maps of how the brain works.
Getting from point A to point B sounds like a simple proposition, but sometimes that journey is as complicated as brain surgery. When neurosurgeons have to operate inside the brain to remove tumors or deal with other problems, they need detailed information on where they're going. That's where fMRI, or functional magnetic resonance imaging, comes in.
Well, primarily we're using it for pre-surgical planning for patients with tumors or other lesions of the brain. And it's been very helpful with regards to giving the neurosurgeon or other physician the information they need to safely perform the surgery. It lets them know how aggressive they can be when they go in to remove that particular part of the brain or that particular tumor.
Dr. Scott Didier, a neuroradiologist at Baptist Hospital Memphis, translates the information gathered from studies done before a patient has brain surgery. A functional MRI is a little different than a traditional MRI because it requires the patient to take certain actions during the procedure. Sometimes it's moving their hand when asked. Other times it's answering a question. The fMRI can track reactions in the brain caused by a patient's actions.
We use functional MRI to map areas of the brain that control specific functions, and we use that information to help guide neurosurgeons and other physicians to treat patients and to let them determine what they need to do to better serve the patient.
Patients receive instructions through earphones or a view screen positioned just above their head. So how exactly does the fMRI show what's going on in their brains?
So when an area of the brain is activated, there's a hemodynamic response and increase in blood flow to that area of the brain. And there is a result increase in oxygen level in the blood, and so that's what we are detecting when we use the MRI technique, the functional MRI.
Radiologists and surgeons can interpret the images, which can show just one section or slice of the brain, or a combination showing complete portions. If a tumor or brain lesion is present, it can change where and how blood flows inside the brain. That shows up in the images, pinpointing the location of problem areas.
In which case you'll see activation that's not in the same exact location as you would expect, but it is not exactly encompassed by the lesion. It can directly affect that area of the brain and cause a defect, a neurological defect, and the patient may not be able to perform that task. In which case we have to individually tailor the exam to each patient depending on their capabilities.
If the brain injury is so severe that it keeps that patient from being able to follow instructions in all the tests, then the radiology team has to make changes to the exams.
Well, ideally we like to run all the paradigms that we have, but we tailor the exam according to what the patient is able to do, what the clinical question is, and the exams differ from patient to patient a little, but they are close to the same for most patients. Most patients that we image can perform all the functions that we need them to, and so we pretty much do most of what we can do when the patient's in the scanner.
But the benefits of fMRI, no need to use radioactive isotopes, a very short scan time, about 5 minutes per test, make it an excellent and effective alternative for people who need brain surgery. For Smart Medicine, I'm Rod Starnes.